This is for duodenal switch pre-surgery patients. It's a visualization to help make your surgery easier. Its purpose is to unite your mind and your body and help them to heal quicker and work together better. Your body hasn't necessarily understood what this surgery is all about. Your mind has collected the information, has spoken with the surgeon, and all of the other steps that it's taken, but your body doesn't necessarily understand what's going on. There is research to show that when you bring your body into the equation, you get much better results, quicker healing, less pain medication, and so forth. So that's what we're going to do now. Let's get started. I want to start this process out by reminding you what your duodenal switch is going to look like. You'll notice up here your stomach is going to be smaller. It's going to be about roughly the size of a banana. This is the portion of your stomach that's going to be completely removed. And then there's going to be stitching here as they relocate the jejunum and the duodenum. And then there's stitching down here as the duodenum is stitched down lower. So notice those 4 places, 1, 2, 3, and 4, where the surgery is going to physically take place. I'm going to refer to those later in the visualization, and it helps to just have a fresh review of these places. Hopefully this is not a new picture to you. This is something you've seen before. So what I'd like you to do is find a place that you're going to be really comfortable, and you're going to just be able to lay there or sit there for about 20 minutes. And we're going to do some visualization to make this easier for you and your body. So let's get going on that one. All right, just start out by taking some nice, deep, relaxing breaths. Find your own best speed as you breathe in and breathe out. And find your best inhale depth and your best exhale speed. And as you breathe in, be aware of breathing in calmness and relaxation. Be aware of breathing out any stress or tension that might be in your body. Everything starts with the breath. So just breathe and slow things down. And as you breathe, begin to notice all the places that your chair or your bed are supporting you and holding you. Just sink down into them farther and farther. Notice how that feels to you. You might imagine a stream of relaxation coming in through the top of your head, the crown of your head, flowing through your whole body, through your head and mind and face and hair, down your neck and spine, shoulders, arms, and out your fingers, down into your torso, your heart, your lungs, all of those organs, to your abdomen, your pelvis, down through your hips, your thighs and knees, calves and ankles and feet, and just flowing out your toes. Releasing and relaxing every tight muscle and tendon, cell in your body. As you breathe in and out, feel yourself letting go and releasing. Start gathering your thoughts to your mind. Slow them down as they gather. And as they gather, let your mind clear. With that clarity, help your mind to relax. Release worry and thoughts of worry. questions and concerns, and just focus on releasing and relaxing your mind and your body. And as you gather all of your thoughts to one place and slow them down until they become still and quiet, imagine letting them float into the basket of a hot air balloon. Put every thought that comes to you there in the basket. Let them float in on their own, or gently move them into that basket. And scan your body and your mind for any other thoughts that might be there that need encouragement to make it to the basket. Once the basket has your thoughts, just gently push it away. That will propel it into the sky. It will rise into the sky like hot air balloons do. Become more and more distant, farther and farther away. Taking your thoughts with it. Leaving your mind free and clear to focus on the sound of my voice. To just relax as you sink deeper into your chair or bed. Take a few more nice, deep, relaxing breaths. Let your aware, awake mind move to the place that it goes when you sleep. Letting it go there and move deeper and deeper into relaxation. As it goes deeper and more relaxed, your unconscious mind begins to become more aware of how you're feeling and of the sound of my voice. We want to work with your unconscious mind and your body. We want to talk to them about the surgery that you're going to have. The first thing we want to do is remind it of that picture that you just saw a minute ago of what a duodenal switch looks like, of those 4 places that will be receiving special treatment, that will be healing, and that will be needing special healing energy, healing thoughts, healing power sent there. And so even now, as we begin this process and you begin to prepare for your surgery, we want to let those parts of your body become aware that they will be the stars of the show. We also want to thank them for being willing to undergo this change, this process. We also want to thank your stomach. It's been so faithful. It's worked so hard all of your life to take in everything that you've given it, and to process it, and to keep you healthy. So thank that part of your stomach that is going to stay, and thank that part of your stomach that is leaving. And as you do that, the part of your stomach that goes, instinctively it knows which part it is. Let it start moving its life essences into the part of your stomach that is going to stay. Let it do that, and it will continue to do that until the surgery, at which time it will have moved all of its life essence into the part that's staying. Now, we want to imagine the surgery day. You wake up that morning, you might be tired, you might be super awake, and you might feel nervous-sighted. That's normal. It's a new life beginning for you. A lot of people call it their second birthday. You'll go in and take a shower, and the doctor may have given you some special thing to wash with, some HIPAA cleanse or something like that to wash the site off with. Maybe you've even been doing that for a few days ahead of time. Different surgeons have different ways. So you go ahead and you take your shower, you get dressed, and you arrive at the hospital or the surgical center, and they're expecting you. They check you in. You go to the waiting room and you wait, and you welcome some time to just breathe and balance and center yourself. And then your name's called and you go back to the preparation room. You'll be given a hospital gown and little footies and get all ready for that surgery. You'll be visited by the surgeon, perhaps, the anesthesiologist for sure, and the nurses who will take your vitals and answer any questions that you have. And make sure that if you have any questions of any of your medical providers, you don't hesitate to ask. Make sure that you have all your questions answered. And while you're in that room, often they start your IV. And if they don't there, they will in the operating room. But your hand or your arm, whichever place they put the IV, will accept it very easily. There won't be any problem. That part of you will be excited to be part of the process and help in any way that it can. So that will go very well. And then they will take you to the operating room. And you may notice that it's a little cooler there than the room you were in. That's normal, natural. And you'll notice as they put you on the operating table that everybody's busy getting things ready. As you sink into the operating table, it's not a very comfortable table, but just let yourself relax into it. You'll be aware of the activity. You'll probably see your surgeon there, certainly the anesthesiologist. And when the surgeon's ready, the anesthesiologist will either give you medicine in your IV or put a mask over your nose and mouth, or your nose, have you breathe in very deeply. And after 3 or 4 or 5 breaths, your conscious mind will be completely asleep. And it will not be aware of the rest of what's going on. And the anesthesiologist will keep you safe and monitor your vitals the whole process, and you're in good hands there. You have nothing to worry about. The rest of the room will be working on getting you ready and prepped for your surgery. The nurses will sterilize the site for the surgery, the incision site. And when the surgeon is ready, they will make some tiny little incisions in your abdomen. Through one, they'll put a tube with air. Another, or even the same one, they'll put a camera in there. And through another, they'll put in the mechanical hand that does the surgery. They'll inflate your abdomen with air first in order that they can move around and see what's going on better. And then the mechanical hand will do most of the surgery. The surgeon will make the cuts and the changes to your stomach that you saw in the picture. And when those cuts and changes are made, they're usually made in one process. So when your stomach is changed, it's both cut and stapled at the same time. And when those parts of your body that have been separated come back together, it's as if they were born that way, like 2 pieces of a jigsaw puzzle coming together. They know exactly what to do and how best to heal. And they'll immediately begin that healing process. The same thing with the changes made in the duodenum and the jejunum, the intestines. Any part of you will know exactly how to come together like 2 pieces of a jigsaw puzzle. It will come to you very easily. And as that happens, everything will go very well. Surgeries go pretty quickly. Your conscious mind will not know what's going on, and your body will be relaxed. The essence of your stomach will already have been given to the part of your stomach that stays, so when it's trimmed off, it will be just like losing excess skin. When the surgery is over, the surgeon will extract the mechanical arm and hand, and the camera and the tube will get as much of the air in your abdomen out as it can. Sometimes there's a little that stays, and it may even cause a little bit of pain for 2 or 3 days, but it goes away. It's absorbed by the body quickly. and it won't be a problem. The surgeon will either steri bandage or stitch your abdomen back together in those little tiny incisions that they made. And again, those pieces will come together just like a jigsaw puzzle, just like you were born that way. And they know exactly what they need to do to heal. It'll be very easy for them. And then on the surgeon's okay, the anesthesiologist will discontinue the anesthesia and we'll continue to monitor your vitals when you get to the recovery room. And in the recovery room, it'll take 15 to 45 minutes for you to begin to be aware of what's going on around you. It may start as being aware that there's people running around or talking, but you'll still be very tired. As the anesthesia wears off, you'll become aware of those sounds even better. And someone might notice that your eyes are starting to open and may even call your name to help you wake up. When you can and become aware that you're starting to wake up, just take some deep breaths to start getting that anesthesia moved out of your system. They'll continue taking your vitals and checking you, make sure that you're doing well. And when it's time, they'll reunite you with your support system and take you to your room for the evening. And in that room, you'll be continually monitored. They'll also perhaps give you something to drink and then x-ray you to make sure there's no leaks in the stitches. And then they're going to ask you to start to drink. Usually it's water, and you're going to sip it in teeny tiny little sips to get your stomach used to working again. And as a new stomach, you'll remember to sip and not try to gulp. You're going to feel different. Your body's not going to feel the same as it did, but it won't be a bad feeling. It will just be a different feeling. There will be some pain, and on a 1 to 10 scale, you want to keep your pain level no greater than a 4. If it gets to a 3.5, you want to ask for some pain medication. And in just a few days, usually it's around 3 or 4, your need for pain medication dramatically reduces. You will also want to start walking as soon as you can. You want to do it with someone there. Make sure your balance is good. Make sure that you can walk to the bathroom and places you're going to need to go. Make sure someone is there the first few times you do that, just for safety reasons. And walking is going to help on so many levels. So do as much of it as you can tolerate, but do not overdo. Find that balance between moving and resting. And so you'll spend the night there, you'll be monitored, and usually you're discharged the next day to go home. And again, it's exciting, and you started a new life right then. So you go home, you remember the plan that the surgeon and the dietitian have you on. You sip really slowly. You do liquids for the first 2 weeks. And then if they say it's okay, then you move to pureed foods. Again, you do it very slowly. You're very aware of what your stomach is feeling. You may not have always been aware of your stomach before when you ate and you fed it. It's time to make sure you're aware 100% of the time. This is the easiest time in your life that you'll be able to do it because your stomach is recovering and has something to tell you all the time. So if you look at the stitches on your abdomen and see how they're healing, know that your stomach is healing about the same rate. So it's helpful to remind yourself that your stomach has to work as it's healing. You want to be very kind to it. You certainly want to give it work to do, but you don't want to overdo. And you want to learn your new habits as your stomach is healing. And so that is the visualization. Before you come back from it, I want you to just stay relaxed. And I want you to do a body scan, starting at the top of your head, moving all the way through your body to the soles of your feet. I want you to notice, now that your body understands what's happening or what will happen, if it has any concerns or any negative feelings or fears about the process. If it does, notice the location and what the feeling is. And remember that, because I'm going to have you write it down in just a minute. I'd like you to do the same body scan, and this time ask your body and mind if it has any questions that haven't been answered yet. If it does, note what the questions are so that you can write them down. All right then, just come on out of your visualization relaxation. Start wiggling your fingers and toes. Come back to the room. Come awake and alert. And we want to do just a little bit of writing. During these visualizations, we get insights sometimes, and they might not even be about anything to do with what we visualized. So if you got insights, please write those down. If you had any fears or feelings that were negative about the surgery, write those down. Write what part of your body had them and what the feeling is. And then go about working with that feeling. If you have a counselor, work with them, a friend, your medical provider, to get those feelings resolved before your surgery, if possible. If not, post-surgery. If you can't get them resolved, or if you can't find someone to resolve them with, you're welcome to call my office. The number is there on the workout page, and we could perhaps have a consultation. Also, write down any questions that may have come to you and discuss those with the proper person. It might be your surgeon or medical provider. It might be your dietitian or someone else. But make sure those questions also get answered so that you can have the very best outcome you can have through the process. Good luck with your new life that's starting soon. I wish you the best, and you've got this. You can do this.